hospitals who got vaccine got it really a couple days before Christmas, and they focused primarily on their frontline healthcare staff. But what we said as that was happening is we understand the long-term care missions continuing. We understand the healthcare workers is going to continue. Many of them have been given their first dose. Actually, today they're going to be doing the booster shots for some of those initial healthcare workers who got the vaccine 3 weeks ago, which is exciting. But once we get into the general community in the state of Florida, our priority is our senior citizens. That's an evidence-based priority because they are the ones that have been most at risk to complications from COVID-19. And so we want to be able to offer vaccine to elderly. And I know they're working hard on doing that here in Jackson. Right now, Jackson has the capacity to do about 10,000 vaccines a week. And we think that that's great, and we think that they're going to be able to do more very soon. They are currently reaching out to all patients that meet the vaccine qualifications, and they are going to be very soon putting out a new online registration system for the overall community. Now, supply is limited, and we ask that you bear with Jackson. They're working very hard, and they're doing a really good job. As supply comes in more, we think we're going to get more vaccine in January than we did in December. There's going to be even more opportunities for folks. But we really believe that the hospital-led vaccination efforts are really crucial to rapidly dispensing COVID-19 vaccinations. This is what they do. They have the infrastructure, they have the personnel, and particularly at Jackson, they have the desire to really make an impact, particularly over these next many weeks. That's why what we've done statewide is ask all hospitals to submit to us, how are you going to offer vaccinations to our seniors? How many do you think you can do on a daily basis? And what we're going to do is, if you have hospitals like Jackson that are meeting or exceeding their targets, then we're going to send them more vaccine. If you have other hospitals that are sitting on it and not using it, then future distributions will be reduced accordingly. We don't want vaccine being idle. We want folks to be able to use it and get it into people's arms, particularly our most vulnerable population. And so I want to thank folks. I want to thank the folks at Jackson, all hospitals throughout Florida. I was just at Orlando Health in Central Florida, and they're ripping through a bunch of vaccinations today. I got to go in and see. You got a lot of elderly population being able to get the vaccine, and people are really excited about it, and we want to continue making progress. But our hospitals can't carry the load all by themselves, and so today we're announcing 4 new initiatives about how we're going to continue with vaccinations in the state of Florida. The first is I've directed our Department of Emergency Management to work with the Department of Health to identify state-run COVID-19 testing sites that can be converted into vaccine sites. And so these would be sites that would be able to vaccinate a significant number of people on a daily basis. And we have directed the shipment of vaccines to long-term care facilities, nearly all hospitals and county health departments, and that obviously has been a major component. But we also want to add a new layer to our vaccination strategy as more vaccine is becoming available. And the number of sites that we can open will depend on the number of vaccines that we're getting on a weekly basis. But we do believe having a broad array of ways for the public to access the vaccine is important, and we think it'll make a big difference. Now, I spoke with Carlos about Jackson also getting involved in this, and he's interested. They'll have an announcement hopefully very soon about doing some vaccination sites at other testing sites like Marlins Park. And I just said, if you guys go forward with that, the state of Florida is going to make sure that you have vaccine to be able to accomplish that mission. So it's not something that's going to happen overnight, but we think very soon you'll be able to see Jackson working with the county and the state and having even additional kind of drive-up vaccine sites. The second announcement is that the state of Florida will be identifying places of worship in underserved communities where we can administer the vaccine. We already piloted the idea at a church in Escambia County, and it was a great success. When one day we were able to vaccinate over 500 parishioners and have them scheduled for their booster shot, which they will receive at the same location. And this is, these churches, when you have the pastor and the people that they trust saying that this is something that is worth doing, that it's safe and effective, that is the best type of testimony you can get. And so we're going to continue to do churches throughout the state, other houses of worship, because we think it's an effective way to reach important segments of our society. And third, I've directed the Division of Emergency Management to immediately execute the contracts that we had, the options to hire 1,000 additional contract nurses to support the vaccination efforts. And as they're needed at a drive-through site, if they're needed at a pod, like we did in Delray Beach the other day, where we showed up in a senior community and were able to vaccinate 500 people, we want this additional muscle to be able to be in the fight. And this is in addition to the 800 National Guardsmen that have been mobilized from the beginning and were instrumental in vaccinating the first 100 skilled nursing facilities in the state of Florida as part of our strike teams. Fourth and finally, I'm directing the State Emergency Response Team to assume additional responsibilities re-administering vaccines in Florida's nearly 4,000 long-term care facilities. Now, currently, the vaccination of residents and staff in long-term care facilities are supposed to be handled by CVS and Walgreens pursuant to an agreement they have with the federal government. But we want to accelerate the pace of these vaccinations in our long-term care facilities. We don't believe that there's time to waste. Initially, we took the reins in the first week because CVS and Walgreens, even though they had doses earmarked for them, were not ready to go. So we wanted to take advantage of that. So those first days in the middle of December, we did over 100 facilities in 6 days. We have a good model for it, and we think we need to continue with that to be able to get these things done as quickly as possible. Another point that I think is important is if you have a drive-through site or any of these other community-based sites, anything that the state's involved in, I've directed that they need to be open 7 days a week. We can't just afford to take weekends off at this point. We've got a lot of work to do over these many weeks. People are interested in this. There's a lot of demand for it. And so by being open 7 days a week, we're going to be better able to meet the demand, particularly for our senior citizens. I've also challenged the hospitals to consider doing the same and offering vaccinations 7 days a week. Carlos here at Jackson, they want to do that. So they're going to be doing 7 days a week. And we hope that other hospital systems throughout the state will follow suit. You know, if you looked at kind of when people were being vaccinated, I mean, you expected it, but Christmas Eve and Christmas, there was almost nothing stirring at the hospitals. New Year's Eve and New Year's, very little. The weekends have been less at the hospitals. Now, obviously, we're going to have some state support doing some things at some of these sites very soon, but we hope that they'll be able to do the weekends because I think it'll make a big difference for our seniors. Now, these vaccination sites that will be open, places like Jackson, Orlando Health opened a number of sites today, are very, very good news, and it's building off what we've done over the first several weeks, where we were able to do a lot of great things. We were the first state in the nation to begin offering vaccines to staff and residents of our over 4,000 long-term care facilities. And that was because we had these strike teams ready to go. When we saw a gap with CVS and Walgreens, we filled it. And just now, a lot of those facilities very soon are going to be getting, the ones that got the Pfizer are going to get their booster shots for the seniors, which would be really, really good. We were also the first state in the nation to begin offering vaccines to EMTs and paramedics. And of course, they're instrumental in helping with the vaccination efforts in a variety of different ways. And we were the first state in the nation to mobilize our county health departments and county emergency managers to actively vaccinate seniors in the community. If you remember, when the first vaccines came, we had the residents of long-term care facilities and the staff, as well as the frontline healthcare workers, as kind of the 1A. That was consistent with what the CDC recommended. But then for the next tranche, CDC initially was going to recommend no seniors and only essential workers. That was not acceptable. There was a lot of blowback to that. So then they said it should be, quote, essential workers and 75 and up. But that would mean a 20-year-old could get it, if they're working, could get it over a 73-year-old. And that's not, I think, an appropriate way to evaluate the risk here. So we made the decision, we're going to focus on our 65 and up population. They're the folks who've borne the brunt of the clinical consequences of COVID-19, and we want to put our seniors first, and that's what we decided to do. And we're going to continue doing that until the seniors who want it are able to get the vaccine. In week 1, the 5 pilot hospitals received their allocation of Pfizer. In places like Jackson, who got the initial allocation, they were vaccinating their staff and the nurses and doctors, but they were also vaccinating other healthcare workers and other hospital systems. And so they were collaborating and really working closely with other folks who are providing healthcare services throughout Miami-Dade County. And we saw that replicated in other parts of the state, and I want to thank them for doing that. And of course, in that first week, we launched our own long-term care mission. We think that that was very successful by having over 100 facilities in 6 days. And now we're going to continue to do that, particularly as we seek to accelerate what's going on with the long-term care facilities. Just before Christmas, we received the first shipment of the Moderna vaccine, which we immediately earmarked to 170 hospitals that span the entire state. And so really only a select few even had the vaccine in the middle of December. Right before Christmas, you started to get it widely available in these hospitals, and they obviously proceeded and worked through with their staffs, with the doctors and the nurses. You know, Jackson's close to 90% on their physicians. I was at Orlando Health earlier. They're at 90% of their physicians have opted to take the vaccine, and so we want to continue that momentum with the healthcare workers too. But it was during that time right before Christmas where we did issue the executive order saying that we're going to prioritize our seniors, and that's where the mission is right now. Last week, we were able to send vaccine to every county health department and nearly every hospital in the state. So now really available on a statewide basis. County health departments began working with local partners in the community to offer vaccines to key constituencies, most especially our seniors. So we had right before New Year's, we went down to Kings Point down in Palm Beach County, and we worked with Palm Beach County Health Department, and we were able to vaccinate hundreds of senior citizens. They were all 65 age and over. They're not in nursing homes or anything. They're living independently and doing fine, but to be able to be there on site gave them easy access. They were able to get the Moderna vaccine, and then obviously in 28 days, they'll get their booster shot as well. So as we enter week 4, we're taking the necessary steps to ensure the vaccine gets administered as quickly as possible. I think that 2020 was not a great year. It was a lot of hardship for an awful lot of people. I think with these vaccines, and you see the work that Jackson's doing, other places around the state, really have a lot of optimism about what we can accomplish over the next many weeks. And so I've told Carlos that whatever you guys need, if you're going to do something at Marlins or you're going to do something somewhere else, let us know. We know you can get the job done. We want to make sure that you have the vaccine that you need to be able to deliver it, particularly to our senior citizens throughout our community. And so with that, I'm going to invite Carlos up to make a few comments, and then I'll let the mayor make a few comments.
Thank you, Governor DeSantis, Lieutenant Governor Nunez, Senator Diaz, Representative Bush, and of course Mayor Cava, for all being here today. As the governor explained, we first got our first set of vaccine as being one of the commonly known as the Pfizer 5 for the state of Florida, of 20,000 vaccines to vaccinate the healthcare workers. During that time, we vaccinated more than 5,000 Jackson healthcare workers. What that means is people that were here full-time, and those were Jackson employees, residents and fellows, UM, and as well as community physicians that actually practice at Jackson. In addition to another 13,000 or so healthcare workers throughout the community, as the governor explained. Today began the second shot of the doses towards those healthcare workers. So we received last Thursday the second shot of those 20,000 doses that we have for the healthcare workers, and today was the first day of that. On the community vaccination side, I'm proud to say that we started a pilot. During that pilot, we've been vaccinating previously Jackson patients who are over 65 years of age. We vaccinated over 1,800 patients over 65 years of age. And we've been providing those vaccines here at the Lynn Rehab Center, at the North Dade Community Center, which happens to be in Miami Gardens, and at Jackson South Medical Center. As of tomorrow at 11 o'clock in the morning, we will be opening our website, which is it's a jacksonhealth.org website, and where you click the COVID-19 link. At that website, you'll be able to schedule appointments 7 days a week at all 3 locations. We will have 2,000 daily appointments for vaccination in those sites. The intent is to vaccinate 14,000 people a week, which is the current allocation we have from the state, and we're very, very proud of being able to do that. We've had some great communications today with the governor. We're talking about doing some of those additional sites, in addition to doing some of the HMO that deal with Medicare Advantage patients. We feel within 2 to 3 weeks that we can gear this thing up to somewhere around the 60 to 75,000 patients a week. If we were to do that, we'd be able to vaccinate approximately 60% of the over 65 in Miami-Dade County, which happens to be a total of 465,000 people, sometime by the end of January, early week of February, and then open it up to the next level of patients. The focus right now has been healthcare workers and people over 65. Once we get to a big percentage of those population, we'll open it to the next at-risk population, and we'll go go on forward. We have been asked, and we are following direction, that we are giving vaccine as fast as we get it. We're not holding back any vaccine, because the supply is coming, and the proof of that is we already got the second doses for the 20,000 healthcare workers, and we believe that the supplies would only get stronger and not softer. So we are very aggressively making sure that we provide every vaccine that we can get. On the COVID status front, I will tell you that as of this moment, Jackson has 159 current inpatients of COVID patients. This is different than we had in July 20th, where we had almost 500 patients. So the number has been roughly flat. It's had a minor increase over the last several weeks. And we're also very proud to say that we have safely discharged more than 4,250 COVID patients since pandemic began. Do I need to say this in Spanish? I noticed TV 51 over there, and I'm assuming Univision. I don't want to say anything, so if I may repeat this in a second. I know, Mayor, you understand about the Spanish and English here.
Oh, absolutely. I'll do the same.
Thank you. En el Jackson Health System estamos muy orgullosos de estar aquí hoy como el gobernador, donde estamos empezando a vacunar. Empezamos en la primera semana de diciembre a vacunar empleados de hospitales, donde nosotros hemos en estos momentos vacunado más de 5,000 empleados de Jackson que trabajan aquí todos los días. Esto incluye los empleados, médicos de la Universidad de Miami, médicos comunitarios que trabajan aquí en el Jackson. Hoy mismo empezamos la segunda dosis para esos personas que tuvieron la primera vacuna. Aparte de los empleados de Jackson, también mandamos vacunas a más de 13,000 empleados de hospitales en la comunidad, donde ellos también están recibiendo la segunda dosis, empezando hoy. En punto de vista de vacunas para la comunidad, nosotros empezamos una práctica con pacientes que han sido pacientes de Jackson en el pasado, de mayores de 65 años de edad, y tengo el orgullo de que hemos vacunado hasta este momento más de 1,800 pacientes. Esa práctica, esa prueba que hemos estado haciendo por los últimos días, en estos momentos se culmina a tener mañana por la mañana en el website, donde va a ser jacksonhealth.org. Y en ese jacksonhealth.org, donde dice COVID-19, van a poder hacer reservaciones o appointments para poder tener su vacuna en 3 diferentes lugares en el Jackson. Aquí en el Jackson Memorial, en la 12 Avenida, en el Little Rehab Center. En el norte va a ser el North Dade Health Center, que está en Miami Gardens, en la 25 Avenida y 162 Calle. Y en el sur, en el Jackson South, que está en la 152, a una cuadra al oeste de Dixie Highway. Este lugar va a estar abierto, el link va a estar abierto a las 11 de la mañana y esperamos tener suficiente apoyo donde vamos a poder vacunar 2,000 personas por día, o sea, 14,000 personas a la semana, y esto va a empezar las vacunas que vamos a hacer en la comunidad conjunto a los diferentes lugares que vamos a abrir con el gobernador, empezando en las semanas próximas, y también usando los HMO que usan con Medicare, podemos pensar que vamos a poder vacunar de promedio de 70 a 75,000 personas a la semana en las próximas 2 o 3 semanas, donde podemos tener un grupo de aproximadamente 250,000 personas de los 465,000 habitantes que tenemos en Miami de edad de más de 65 años de edad. Aparte de eso, en lo que es en la porción de enfermos de COVID en estos momentos, en Jackson hasta este momento tenemos 159 pacientes en camas con COVID. Muy diferente a lo que tuvimos en julio, donde habíamos casi 500 pacientes. Este número ha estado bastante similar durante las últimas 2 semanas, con un crecimiento bien poco. Y más importante, estamos muy orgullosos de que ha empezado esta enfermedad, que hemos ya podido mandar a la casa más de 4,250 pacientes que han podido superar COVID. Y con eso termino mi reporte. I'm finishing what I've got here, and I'm very proud to introduce to you Mayor of Miami-Dade County, Daniela Levine Cava. Mayor.
Thank you, Carlos. Thank you. Well, I am very proud to be here today, along with the governor, the lieutenant governor, our elected state officials, and Carlos Magoya of Jackson, because we are underway distributing this vaccine, as you have heard, and we are collaborating. The governor spoke about the collaboration around the state. That is what we are doing right here in Miami-Dade County. And the partnership between Miami-Dade County government and Jackson has never been stronger. And we have our new Chief Medical Officer, Dr. Peter Page. If you would wave your hand, Dr. Peter Page, Dr. Abo, part of the team, many other experts, and we are working lockstep to make sure that everybody gets the treatment they need, but also people so desperate for this vaccine get it as soon as possible. And we commend Governor DeSantis for prioritizing people over 65 and working so diligently to make sure that the vaccine does not stay in the refrigerator, but it gets into people's arms. We're with you, Governor. So truly, it's been all hands on deck. And as county mayor, my job has been to be communicator in chief, to bring together all of the different distribution points to the same table so we can communicate with one voice. We're going to be partnering with the Department of Health on their appointments. We're partnering with Jackson. You've seen our county medics helping with the vaccination inside here today. At the county level, we have our own supply that was provided, and we are coordinating as well to get it out through our private, and working together with private companies, our cities, and the Department of Health, and was said already 30,000 vaccines as of yesterday. Very impressive. So our website, miamidade.gov/vaccine, is the centralized point of information so that all of the updates can be in one place. There are independent places to register for appointments for Jackson and some of the others, but we want to be sure that the public doesn't have to go searching all over to find this information. We want to be a single point of contact. At the county with our supply, we've been rolling out with our firefighters and our medics. We have been starting our homebound seniors program in public housing, and we're also expanding to all seniors who live in county public housing. We're also rolling out to our county employees over 65, the most vulnerable frontline workers in transit, water and sewer, and the police department. So these are our critical employees that serve the public, and they are part of the priority. So we're working together to keep our community safe, our economy moving forward. Getting the vaccines out as quickly as possible is the way we will recover our economy as well. Ahora en español. Aquí estoy muy orgullosa de estar junto con nuestro gobernador, nuestros representantes, el senador y el ejecutivo del Jackson, Carlos Magoya. Estamos colaborando con él más que nunca. Tenemos primero nuestro director médico para esa crisis, que se llama Peter Page, ahí está, y también con la doctora Abo, también una parte de nuestro grupo de expertos, y estamos trabajando juntos para que la vacuna llegue a la al brazo de todos los residentes y que no queda en la refrigeradora. En el condado estamos colaborando con todas las ciudades, las compañías privadas y el Departamento de Salud Público. Estamos unidos en dando las citas para comenzar. Ellos comienzan en la semana entrante y en el condado mismo tenemos nuestras vacunas que ya estamos dando primero a los bomberos y los de mayor edad que no pueden salir de su casa, que viven en nuestra vivienda pública. Y después estamos siguiendo con los que viven en vivienda pública de 65 años y más. Y después los trabajadores del condado de 65 y más, especialmente los que están en más riesgo, los que trabajan con el alcantarilla de agua y los policías y los que trabajan en tránsito. Y vamos a seguir adelante unidos, comunicando con el público. Tenemos el website, página red, miamidade.gov /vacuna, donde gente puede ver cuáles son los lugares donde hay la vacuna y cómo arregla las citas. Y vamos a seguir adelante colaborando hasta que todos que necesitan la vacuna lo reciben, y para adelantar nuestra economía, eso es lo más importante, que combatamos el COVID con la vacuna. Gracias.
Well, thank you, Mayor. And I just want to underscore something that Carlos Magoya said. We were, as soon as the Pfizer news came out, I flew up to Washington. I met with Operation Warp Speed, HHS, FDA, CDC, to make sure that we understood what was coming down the pike and that we could execute it. And one of the issues was when you have a 2-dose vaccine, when you send it to us, are we supposed to use half and then save the half to do the booster or not? And they said, whatever we're sending you, you use, because we're not going to send you unless we have the booster that can eventually be sent in the right time. And so I know some people have had questions about that, but they couldn't have been clearer about the direction that we want to go. So they should use their vaccine. The fact that we were shipped this number of vaccines means per Warp Speed that we will be getting the booster shot. And so that obviously allows them to really work through. The other thing I would say, Carlos mentioned, their hospitalized patients are less than half of where they were over the summer. And I think part of it is because we were actually having this discussion earlier. Jackson is doing a good job using the monoclonal antibody treatments. You have Eli Lilly and Regeneron. I don't know if you have both or one of them. But if you're 65 or over, or if you're a high-risk patient and you test positive, particularly if you don't have really severe symptoms, you go in early and get that treatment. There's been really good results. I think all the physicians I've talked to have been positive about it. The goal of it was to take someone that was at high risk of hospitalization and using the antibody treatment really neutralize and prevent a hospitalization. There have been a lot of people that have done it. Obviously, the president was one of the high-profile ones taking Regeneron, but I've talked to folks all around the state who did it. They have good things. So I would just tell people, if you're in that boat, maybe you're 70, you test positive, you have mild symptoms, you really should talk to your doctor about whether the monoclonal is something that you should be doing, because I think it's got a pretty good track record so far. Obviously, it's still under an emergency use authorization, but people just need to know that's out there. There's obviously, rightfully, a lot of attention paid to the vaccine, but we also want people to know that the treatments today are better than what they were in the summer and way better than what they were in the spring. Yes. So I don't know that, I'm not sure, where is that happening? All right, so they're homeowners, basically. Correct. Yeah, so basically the way we've told people is, look, we're a transient state. You'll have people that be here. I mean, it's not like they're just vacationing for 2 weeks. You'll have people who are here 4 or 5 months a year. They have relationships with doctors. They get medical care in Florida. They obviously are involved. So that's a little bit different than somebody that's just doing tourism and trying to come here. So we are discouraging people to come to Florida just to get a vaccine. And obviously, I think if they called Jackson and said, hey, I'm in New York, I can't get vaccinated, can I come down? We would say, don't do that. But if you have folks who spend 4 or 5 months a year in the state of Florida, I don't think we want to get in a situation where we're trying to say, oh, no, you go back to Rhode Island or you go back to Minnesota or wherever. So if they're here, if they have a residence and they're not just kind of flying by night for a week or two, I'm totally fine with that. Obviously, we want everyone to get access to it. But it just becomes an issue that I think that may have been a pod that was set up there. So if we set up a pod at a senior community, we're really letting those residents sign up. But like when we were in Delray Beach, all those people are actually residents of that community. We didn't check to see whether they're there 12 months a year, 10 months a year, 6 months a year, but they're all residents of the community. If they get sick over the winter, guess what? They're going to come to a hospital in Florida. So I think if we're trying to mitigate the disease and the clinical consequences, I think the people who are here that are over 65, and again, that's much different than someone just showing up and saying, give me a shot, and then they're going to fly back somewhere. We obviously are not going to do that. But for seasonal residents who are going to be here, I think it's totally fine if they want to do it. Yes, sir. So the question is, how is that going to look, in late January, February? What I would say is, we're in a rhythm now. I would just continue following through with what we see. I mean, at the end of the day, this is a very difficult logistical operation. I'm not going to say that there's not been any problems, but I think all in all, the distribution has gone probably better than what would reasonably expected. We have the intention or the expectation that we will get additional vaccine over and above what we got in December. So we were in a certain range. We think that the way that's set, it should be 50% more in January than we got in December. That will be something that will be very good as we're getting it out in the community. The other thing I would just mention to people, because I know people have a lot of questions, say, oh, my husband works for the utility, or my wife's a teacher or whatever. When are they going to be able to do it? Obviously, 65 and plus is the priority, just based on clinical data, on evidence of people that have the most severe outcomes. But I think this Johnson & Johnson vaccine, we think there's going to be clinical data that's going to be produced sometime this month, maybe very soon in January, and we think that they're going to file for an emergency use authorization sometime at the end of January, beginning of February. What that will mean is, if that's approved and if it's efficacious, which we think it is, you will have a one-dose vaccine on the market, perhaps as early as sometime in February, that is going to be produced at a very wide scale. So when you're talking about getting into the workforce and things, once we get beyond the 65, that is going to be a great tool to be able to go, because you can go in some of these workplaces and you could do it very quickly, one shot. You don't have to worry about going back. You don't have to worry about whether there's going to be the booster shot. So we're really keeping an eye on the Johnson & Johnson. This AstraZeneca vaccine was approved in Britain. We're looking at how that's doing. They haven't even filed for emergency use, I don't think, in the United States. They hadn't as of last week, last time I checked. I don't know what the efficacy of the AstraZeneca is. Of course, the two vaccines that we're distributing in Florida have 95% efficacy, so that's a pretty good track record. AstraZeneca, I don't think is quite at that level. We're hoping that Johnson & Johnson is a 90+% efficacy, and if that's the case, then that's going to be a great option for a lot of people. And also, Johnson & Johnson doesn't need to have the extreme storage like the Pfizer. It doesn't even need to be frozen like Moderna. It could be just regular refrigeration. And that's a really big deal, because when you're talking about setting up like a test site somewhere, to not have to worry about any type of special storage, that makes the administrability of this much better. It's a lot of demand. I mean, I think at the end of the day, excuse me. You just said what has gone wrong, so I'm answering the question. So you're going to give a speech, or you're going to ask a question? You asked a question. I'm going to answer it. You're not. No, you're giving a speech. You asked a question. You're going to ask how many questions? You get 3? They only got 1 question. Why do you get 3? You didn't. You finished the question. So you're repeating your question. Where was that at? And why was, like in Lee, why did that happen? Did you investigate why?
That's my question to you, Governor. You're the governor of the state. I'm not the governor of the state.
Okay, but you didn't investigate why that, like in Lee County, why was there a big line? Did you investigate why? Because we distributed vaccine to hospitals, and the hospital said, first come, first serve. If you show up, we'll do it. So they didn't use a registration system. There wasn't anything that was done, and there's a lot of demand for it. So people are going to want to go ahead and get it. So the state is not dictating to hospitals we're not dictating to Carlos Magoya how he runs his operations here. That would be a total disaster. These guys are much more competent to be able to deliver healthcare services than a state government could ever be. So we're empowering the hospitals. 80% of the initial doses over the first 3 weeks were to hospitals, and you've seen places like Jackson really take the bull by the horns. And yeah, when there is an issue like that, I think the hospital, they made a course correction and they decided to do it a little bit differently. So, but here's the thing. If you're 74 years old in the state of Florida, we've made the decision that we want you to get vaccinated. You are eligible and you are a priority. And we're going to do all we can working with our healthcare partners to make sure the vaccine's getting out to you. If you're a 74-year-old in most states in this country, you have no shot at a vaccine right now. You are not eligible under most of those states' guidelines to even get vaccinated. So by opening up to 65 and by prioritizing our seniors, we said from the beginning, we have 4.4 million people over the age of 65. Do we think 100% are going to want it? No. Do we think many will want it? Probably a majority. Yes, we do. Did we make clear at the beginning that we don't have millions of vaccines on hand right now? Of course we did. And we've asked people to be patient. I know there's a lot of demand for it. I know people are chomping at the bit, and we're going to get there. But we really believe trusting these folks to be able to deliver this makes the most sense. Of course, I outlined today a number of steps we're going to do to supplement that, and I think we can play an important role in supplementing it. But just understand, the demand is exceeding supply, partially because we've made the decision to prioritize our senior citizens. That should be a decision, I think, that every state in the country is making. That has not necessarily been the case. And I think if you look, I think it's Colorado, Texas, Florida, Georgia, Louisiana. The rest are not doing that. In fact, some of them are going to situations where you could have someone working in a supermarket who's 22 years old and perfectly healthy get it before a grandmother who's 73 years old. That does not make a lot of sense in my book in terms of dealing with this particular virus. So we're going to continue to do it as we see more opportunities to be able to help. Obviously, with more vaccine coming in, that gives us more opportunities to do the drive-through sites, to expand the pods. We're going to continue doing things at places of worship. We talked to Representative Bush about doing more with African American churches. So you're going to continue to see things like that. And I think that if you look at the momentum, I think that you're seeing so far today, I think that there's a lot of room for optimism. Remember, most of these hospitals did not get the Moderna until right before Christmas. So we said at the time, you're not going to have mass vaccinations occurring on Christmas Eve and Christmas. A lot of their staff isn't going to be in. New Year's Eve and New Year's, not the greatest time. The United States, I think we're third in the country for per capita vaccination so far. Israel is number one with a bullet. They do a great job. But understand, if the Israelis got it 2 days before Passover, they would not have vaccinated as many people. So I think we're in a situation now where being in Orlando Health, being here in Jackson, they're really working hard. They're having really good output, and I think you're going to see that across the state. And as I mentioned, and I think Carlos mentioned, they're going to continue to tweak their ways where people have reservations. I know they're working on additional accoutrements in that regard, and that's a really, really good thing. So, but at the end of the day, we've made the decision in Florida, our seniors come first. And we're going to stand by that. We're going to stand by our parents and grandparents, and we're going to work with anyone who wants to work to help get those shots in the arms for any senior citizen who wants it. Thanks, everybody.
Governor,